Okay, hello everyone. My name is Amy Salazar. I am an associate professor at Washington State University, Vancouver, and I'm also part of the executive leadership team for the National Research Collaborative for Foster Alumni in Higher Education. Thanks so much for joining us today for the webinar series. Just a reminder that we do record all of our webinars and post them on the NRC FAHE's YouTube page. And we also put a PDF version of all of the slides on the NRC FAHE website. So you can always go back and see all of our previous webinars on those two sites. The website's listed on the screen here that I'm sharing, www.nrc-fahe.org. And if you're not already a part of our listserv, you can go to that website, scroll down on that main screen, and there will be a place where you can join, subscribe to our list. So I just want to let you know that there are live transcript options, closed captioning options that should be popping up for you that are available via the Zoom menu if they're not automatically popping up. So before we get started with today's webinar, I do want to mention our next scheduled webinar. And we're excited about this, or we're excited about all of our webinars, but our next one will actually be something new that we haven't done before. We're going to be doing something called NRC FAHE Lightning Rounds. So this will take place on Thursday, September 29th from 11 to noon Pacific, which is 2 to 3 Eastern time. And the description of that is a lightning round is a chance for an NRC FAHE member to present a research, practice, or policy challenge that they're grappling with and draw on the wisdom and expertise of other NRC FAHE attendees. Presenters will receive instant feedback to their most pressing questions. And right now we're in the process of recruiting 2 presenters for this September 29th webinar. We're going to recruit 1 researcher and 1 policy or practitioner. So there's a link in the most recent email sent out for a 4-minute video to learn about the lightning rounds, and there's an application process. And so I will put those in the chat once our presenters get started. But we'd love for you to join us either as a presenter or as an audience member to help contribute to helping our practitioners and researchers think through challenges that they're facing. So again, I'll put all that information in the chat once I hand it over to our presenters today. But now I want to switch over to our presentation for today. So just to give you an idea about what will be happening, our presenters will be presenting for about 35-40 minutes on their project, and then we'll save some time at the end for Q&A. So if a question comes up for you during the webinar, please go ahead and type that into the chat. And we will read those out for our presenters at the end of their presentation. Okay, and so I'm going to go ahead and introduce our presenters for today. So today we have Drs. Liz Aparicio. Oh my gosh, I hope I said that right. I'm so sorry, Liz, if I didn't. Please feel free to correct me. Who's an assistant professor at the University of Maryland School of Public Health. And we also have Dr. Svetlana Shpiegel, who's an associate professor at Montclair State University Department of Social Work and Child Advocacy. And they'll be presenting today. Their presentation is entitled, "It Was Hard to Connect, Experiences of Education During the COVID-19 Pandemic Among Young Parents with Foster Care Backgrounds." So I'm going to go ahead and pass it over to you all.
Wonderful. Thank you so much. Let's get our slides going. So it is such a pleasure to be here with you all today. I'm Liz Aparicio, and I'm one of the co-PIs for this project, along with my colleague here, Svetlana Shpiegel. And we're really excited to be here today to tell you about this study. A little bit of background on our study team. This study was conducted in partnership with university and community-based organizations, as well as community-based youth researchers. And that structure was really important to making sure that we were able to really fully uplift and contextualize and share with you now the experiences of young parents who were in foster care or had recently aged out of the system, their experiences during the COVID-19 pandemic. As I said, Svetlana, Shpiegel, and I are the co-principal investigators. We had a really wonderful data collection partner, Dr. Genevieve Martinez Garcia, as well as our youth co-researchers, Alexander Sanchez and Sheila Van Wert. Big shout out to our graduate students who make everything run and everything happen smoothly. Marissa, Michelle, Amara, and Jen. And we had an additional collaborator, Dr. Rhoda Smith, who's at the Erickson Institute. So big team, lots of fun, really great group of people to work with on this important study. We want to thank our funder as well and give them acknowledgement. The Annie A. Casey Foundation funded this study. And of course, the opinions here are those of the authors and not of the foundation. All right, a bit of background here. So as everyone knows in this room, you all have, as we all have, experienced major impacts of the COVID-19 pandemic. And the COVID-19 pandemic has really had very much so disproportionate impacts on many populations that were already made vulnerable by social inequities. Those populations include youth in foster care and parents of young children. As a bit of background, because we really are focusing now on these two populations, young people who have been in foster care become, first of all, you probably know this, but become parents much earlier than their counterparts in the general population. And on average, about 20% of young women and 10% of young men become parents by age 19 who are in the foster care system. And of these figures actually rise to 40 to 20% respectively by age 21. So that equates to about youth in care, and it depends on the jurisdiction, but youth in care have about a 2 to 3 times the population rate of teen pregnancy and parenting. It's a very high rate. We also know that parenting youth have experienced unique challenges during the COVID-19 pandemic due to things such as closures of schools and childcare centers, increased caregiver burden, as well as limited access to school-based services and supports. And these challenges may be especially pronounced among youth with foster care backgrounds because they tend to already be economically disadvantaged and to lack family safety nets and other critical supports. The purpose of our study was to extend the existing research on the experiences of foster youth during the COVID-19 pandemic. So that includes, for example, the work of Greason and colleagues and Ruff and Linville. Our focus was really on the unique experiences of those who parent young children. And we're focusing this presentation today on specifically their experiences of education. So a bit more background in terms of the context here. So our study really sought to understand how the COVID-19 pandemic was impacting a population that we already knew needed additional support. So these young parents who were either in foster care or who had recently aged out of the foster care system. And as folks may or may not know who are listening, aging out of the foster care system, we mean here to mean that youth were discharged from the foster care system without being formally reunited with their parents or another caregiver or adopted. And we're specifically in this study looking at the period of time here between January 2021 and March 2021, which was at the tail end of a really large case surge and the beginning of the vaccine rollout. So you'll see here in this graph, the blue, it indicates daily cases in the United States, and the red line is 7-day case average over the period of the pandemic, right? So our red box here in the middle is the data collection period. So just to give a bit of context, since we are still in this ongoing pandemic. So we really wanted to use this time with you to talk about the specific piece of our findings, how the COVID-19 pandemic has impacted educational experiences among young parents in foster care and young parents who've recently aged out of the system. And just as a spoiler alert, as one of our participants shared in her photograph, nothing was ever the same again. Some information about our background, on our study design. So we used multiple qualitative methods in this study. We had 26 participating youth who were between the ages of 18 and 26. Our data collection included 4 focus groups with young mothers and 3 individual interviews with young fathers. It was much easier to get individual interviews with the fathers versus trying to bring together the dads in one group. So we pivoted to make sure to hear their voices through that other option. We also conducted a photovoice project with 9 youth. And so we had 17 youth do either a focus group or individual interview, and then 9 youth do the photovoice project. So you're going to see incorporation of both photovoice and interview data here. And as I mentioned, the data were collected January to March 2021. In terms of demographics of our 26 young folks, they were mostly women. We had 4 young men, and the remainder were women, cisgender women. In terms of race and ethnicity, we had a very diverse group, as you can see here. That really reflects the diversity of youth in foster care. Most of our participants were BIPOC youth, either in care or who had recently aged out. In terms of their ages, as I mentioned, they range between 18 and 26. The mean was about 22 years old. They were all currently in or had recently transitioned from foster care. They had between 1 and 4 biological and 0 to 1 non-biological children that they were caring for. We did include that as our, we did include that option that we wanted to have young folks who were caring for example, siblings or other children that they were responsible for, as is often the case. The children's ages range between, for the biological children, 14 months to 10 years, and for the non-biological children, 1 to 17 years. In terms of their current living situation, they had lots of different living situations. So most of them were in their own apartment, but we had several folks who were living with a spouse or a parent who was the parent of the child or not the parent of the child. Some lived with a biological parent or relative. Others were sharing housing with a friend or the family of the child's father. And we did have several folks who were experiencing homelessness, who were either in a homeless shelter or were couch surfing. And then we had some that were in independent or transitional living programs. In terms of education experiences, 27% of our sample was currently attending a 2 or a 4-year college. So a sizable percentage of them. And of our full sample, 38% reported that the pandemic had negatively affected their educational attainment or progress, for example, grades and school enrollment. And the reason why we are including that statistic for the full sample is because we're really trying to indicate how the pandemic affected both currently enrolled college students as well as those who would seek to enroll in college and wanted to continue their education. So it really was, it affected a large group of people. The darker shaded states here are states that we had representation from in the study. So youth were from all over the United States, from Alaska to Vermont. We had lots of different representation across the United States. In terms of analysis, we transcribed all of the focus groups, all of the individual interviews, and 2 of the 3 photo voice sessions. And then we analyzed those data using thematic analysis, which involves line by line coding, sorting the codes into themes, and then comparing the themes against the data set. And here we're really focusing on, again, the educational experiences. There are additional themes that we'll touch on a little bit, but we'll also point you to our other resources for your information. Okay, I'm going to turn it over to Svetlana.
Thanks, Liz. Now I'll need you to use the slide function so we can go between slides. So I want to walk us through our results. So we really found some striking impact of the COVID-19 pandemic on youth educational progress and their educational attainment. And we grouped them into sort of several different ways in which the pandemic affected their education. So I'm going to kind of mention a few of them and then show you some quotes from young people that will illustrate kind of the extent of that impact. So wait, no, Liz, can you? Yeah, I'll tell you one. Thank you. So one of the things that the young people talked about are difficulties that were related to campuses being abruptly closed and how that impacted their ability to access campus-based resources. So they talked about kind of, oh, I've used the library, I've used food on campus, I was employed on campus, and all of a sudden, campus closed, and now I don't have access to any of these resources. So Liz, if you scroll back to the next slide, I'll show you a quote that relates to that. So this was Angel, one of our participants, and she said this: right now, I've been trying to graduate for a while, but when COVID started, it was difficult when it came to going into classes. It made it really difficult for me because as somebody who's been trying to graduate for a while, I couldn't go into my classes. I couldn't go in and study. I couldn't get the books I needed because the library out here closed. So this really shows kind of like the extent of this abrupt closure, and the young people that we talked about didn't really have any contingency plans to accessing those resources. So some of our young people said, well, if I can't go into the library and study, I don't really have another quiet place to study because I have children at home, right? Or if I'm employed on campus and I lost that employment, I didn't necessarily have any other easy way of getting employment and getting some other kinds of resources. So that was one educational impact that several youth talked about. And Liz, if you could scroll up for a second. We're going to cut, no, to the previous slide. Yep, we're going to go back and forth between this to show quotes. The other effect that a couple of young people talked about are difficulties transitioning and adjusting to online learning. So those of us who teach college, we know that this is not necessarily unique to these young parents. A lot of students had challenges transitioning to online learning, but this was particularly pronounced in this population because they had other kinds of stressors that they experienced, and many of them came to college with some challenges and pre-existing disparities in terms of education. They talked about kind of not being able to communicate with their professors, that being hard, and just in general, some of them started college not long before the pandemic began, and they sort of talked about how difficult it is to adjust to college, which is hard for them in general, and do so online when they don't have any interaction with their professors, they don't necessarily have interaction with peers, and they just have to do this in isolation. Some quotes related to that, Liz, if you could scroll 2 slides up. Yeah, this one. Nope, the one before. Thank you. So, and if you can make me co-host, Liz, maybe I could do that. I don't want to. I'm sorry, I have to burden you with doing this. So here's what Aya said about this. I'm going to school because I'm a student, and everything switched virtually, and it was really hard to connect and communicate with professors. So again, this issue of I'm not sure how to access my professors. I don't feel comfortable emailing them, or sometimes when I email, they don't respond. Things like that came up as challenges. And Tita also talked about this, and she said this: I have already been out of school for a year now, and I decided to go to college. And this experience, like doing it over the computer, has been difficult for me. Just kind of overwhelming and makes it even harder. So you could see this is sort of to the effect that I've already am feeling uncertain about college. It's hard for me. It's not necessarily an easy transition. And now I have to do this over the computer, and that makes it really overwhelming. Another challenge that the young people experience, you can just scroll down. Yep, that works. Is lack of childcare and the effect that had on young people's educational progress. So essentially, young people talked a lot about difficulties with childcare and how that affected access to the things that they needed to do educationally, but also their ability to focus on their education. They talked about things like I need to do something for school and I'm not able to do that because I don't have childcare. They talked about how they have to manage their own education and their children's education, which we'll talk about a little bit later. And as if you could scroll down, I'll show some of the quotes related to that. So one young woman said, I have like one more test to get my GED, and I wasn't able to go because COVID happened and closed the testing center. And now they opened it back up and I don't have childcare at all to do it. So if we think about these young parents, a lot of them, they don't have family support, right? And in the context of a pandemic where people were really careful about meeting with other people, their options for informal childcare were really limited. And the options for formal childcare were limited as well because daycare centers and schools have closed. So for young parents that don't have that family safety net and people that would be willing to meet with them during a pandemic and take care of their children, their ability to continue their education is very much disrupted, right? There is not a lot of options that they have. Because you could just scroll down rather than going back and forth. So this is a photo voice. This is an example from our photo voice. And this also kind of demonstrates this issue with childcare, because even when young people were home and trying to focus on their education, they also had to do a lot of other things related to their kids. So this young woman said, while I try to work from home, my kids want to play. My kid doesn't like online school. He finds it hard to get up in the morning and jump on the iPad, right? So they had to manage their children. Many of their children were very young. Their ability to really sit through school on Zoom was really limited. So these young moms and young dads had to not only try to focus on their own schooling, but also they didn't necessarily have any childcare and somebody who would be able to help their kids to do their schooling, right? So they had to multitask and do it all together as a family. Scroll one down, Liz. Just one down, yep. This is another photo that sort of illustrates how difficult it is, or it was, for these young parents during kind of the height of the pandemic. They talked about constant demands, right? They didn't necessarily have any place where they could just kind of focus on school or work. They had always had to interact with their children, helping their children navigate all the challenges that they've experienced themselves, right? So this is just a photo that one of our young people submitted to us. Yeah, you can scroll down, just one down. So the other issue that young people talked about is this problem of navigating their own school and their children's online learning. And they talked specifically about technology-related challenges. So a couple of young people just said, it's just really hard. We have to navigate the requirements for our education, right? And do all sorts of things on Zoom. And then our kids have to do the same thing. And we have to be able to supervise all of that without necessarily having help or resources to do so. So Juliet talked about it, and this is what she said. It's bad. It's a complete mess as far as my own schooling and the kids' schooling, between computers shutting down and like the different ways that teachers are teaching now versus where I learned, and navigating the different systems that everybody has for everything. It's just so many programs and so many different things to keep track of. So that's really a good quote, kind of shows how hard it is to try to do it all, not just for themselves, but also for their kids. If you could scroll one down. And then one of the major themes that kind of came about from this study had to do with mental strain. And you talked about that in conjunction with education and also kind of in larger context. So they said that even when they were able to somehow navigate having somebody looking after their kids and having the time to sit and devote to their schooling, they said, my heart just wasn't in it. My concentration wasn't in it. I'm stressed and worried, and I'm just not able to get this done. And Juliet talked about this. This is what she said. The impact it had was because of my mental stability. With COVID and then all the extra things that I was doing every day, and then not being able to go out and get that interaction I needed, it kind of mentally impaired me from being able to focus on my classes. So when I would sit down, the quality of my work was not where it should be, and the effort and the time that I'm willing to put towards it, right? So she was really talking about how she just couldn't get herself to the right kind of mental state to really focus on education because of all these competing demands that they were facing with. And a lot of our young people talked about being parents in that context, right? So obviously it's hard for everybody. Pandemics, right, and stressful situations and emergencies are hard for all students, for non-parents as well. But being a parent in that context and being a parent that ages out of care, that has its own challenges related to that, right? That is a big, big kind of conjunction of different factors that made it focusing on education really hard. You can scroll one down. This is another quote and a picture from our photovoice project. And the young people talked about kind of how this mental strain was sort of exacerbated in some ways by all of the technology and the challenges that went into that. So Asteria, one of our young people, said this: during COVID-19, we were glued to our electronic devices. I needed help for my depression and anxiety. I didn't want to live like this. It was affecting my family too. We all needed a break. So then this is the picture from the break that they took, right? We love to go out on adventures. We've grown so much this year. As a couple, we grew stronger in our communication. My children know that we're in this together and we will get through the tough times. So you could sort of see how being isolated on a computer, having to navigate their own school, or sometimes work, having to navigate their children's school, it was really difficult for these young people, and the mental health impact of that was certainly not something to overlook. But there is also a lot of resilience in that statement, right? They worked through it, they managed to grow stronger as a family, and we've heard a lot of some of the silver linings and positive effects as well in our study. You can scroll one down, Liz. The other thing that the young people talked about in relation to this kind of having to do it all and the strain is some of the things that had to give sometimes, right? So Lati, one of our young people, said, I used to cook or bake something like rice, chicken, but now it's a lot of work with him, work and school. My son should be eating better than that, but what can I do? So these are really the compromises that some of these young people had to make just to get through, right? To get through their own work, to get through their schooling, to help their children with their schooling. Sometimes things had to give, and sometimes that was the compromises that they were making. If you can scroll one. So these were sort of the effects that are directly related to education, but the young people also talked about contributing stressors that affected their educational attainment, but also had larger impact. And I just wanted to talk about two of those that were most relevant. We talked about mental health already, but the other two that they talked about were employment disruptions and the financial challenges that created, and also lack of access to supportive adults to help them navigate any resources that they could actually access during the pandemic. So if you scroll one down, in terms of economic effects, young people talked about not being able to afford basic needs, right? So certainly they struggled with education-related expenses such as tuition. So this is something that Angel said. I guess one of the biggest issues right now is probably food, right? Because I used to get food stamps towards the beginning of COVID, and now I'm not. I have to reapply for them, but food and definitely like buying diapers and some essential things for my son is difficult right now because I don't have an income. So this is a young woman who used to have a part-time job and that was disrupted. And now she is not sure how she's going to afford basic needs for her child, right? So again, this is not directly related to education, but as you can understand, for young people who cannot afford food and diapers and other essentials anymore, education automatically goes to become the last priority. If you could scroll one down, Liz. This is a photograph from one of our photovoice participants, and they talked about kind of working as an essential worker. And this is what she said: it's good money, but I don't work as much. Without daycare, it's hard to get a better job or a second job right now, right? So even though some of the jobs for essential workers were available at certain points of the pandemic, but they didn't have childcare, so they couldn't necessarily take advantage of that, right? So those young people who were able to keep their jobs as essential workers weren't necessarily able to work as much as they used to work before the pandemic. And if you could scroll one down. And this is another challenge that young people talked about that created a lot of employment disruption and economic hardship. It's just worries about getting COVID. Remember, this is relatively early in the pandemic, before vaccines were widely available, right? So this is what Sam said: I stopped going to work because COVID cases were spiking at my job. Like, someone was testing positive every week. So a couple of other young people actually brought that point up, and they said that they were worried about their young children, right? They were worried that if they would go and keep their job, they would bring COVID home, and not only would they get sick, but their kids would get sick as well. So some young people had to make the difficult choice of discontinuing their employment or cutting back, but they didn't necessarily have any good backup options for income. If you can scroll one down. And then the last issue that we really wanted to highlight is this problem of lack of access to supportive adults. And that relates to education and also to other things. It relates to education because if young people were at school and they were trying to figure out ways to get some grants or funding for their education, there was really nobody that they could turn to that would help them navigate either finding opportunities, or when they found them, and a couple of young people talked about that, they weren't able to figure out the documentation. They couldn't navigate it on their own, right? So this is something that one of our young fathers said. His name is Donatello. I'm in Iowa aftercare and I have an advocate. When the corona pandemic and everything happened, we stopped having face-to-face meetings. My aftercare worker would help me fill out other paperwork for grants and, extra funding and things of such, which then became harder for me to acquire because I don't particularly know where to get those kinds of things. She kind of helped me walk through the filling out process on certain things that I didn't understand as well. This was a really prominent theme, again, in relation to education, but also in relation to larger struggles related to COVID. Young people talked about not knowing how to get resources, even things that were supposed to help them, like stimulus checks, right? Not all of them were able to figure out, how would I get that if I was, if I don't have my own taxes that I submit, would I be eligible for that? If not, what should I do? Is there any way for me to access that money? And without those supportive adults that a lot of these young people got through programs that support former and current foster youth, they really weren't able to get that without those helpful adults. If you scroll one down. So kind of in terms of summary of what we discussed, there were several negative effects of the pandemic on young people's educational attainment, and a lot of that related to campus closures, difficulties with transitioning to online learning, and also difficulties managing all the other stressors, including their children's learning at the same time. And then, as I've said before, the young people talked about other stressors that contributed and created issues, mental health challenges, financial problems, and they talked about not having enough resources and not having adults to help get the resources that they need or navigate the application process for the resources that they were able to find. So if you just scroll one more, so what does that mean, right? What do we think can be done? There are a couple of different implications. There are some implications for the child welfare system and some for kind of institutions of higher education, which is what we're going to focus on here. So we really think that the first thing that is really important is that higher education institutions should plan for how they would maintain access to critical resources to high-risk students if the campus is closed, right? What is the alternative option for those students. And because everything happened very suddenly, most institutions didn't really have a plan for that, right? They closed, and then they sort of started scrambling, trying to figure out what they could do to help students. We have the experience of the pandemic now, so I think we have to take advantage of that and try to plan for emergency better, right? This is likely not going to be the last pandemic, and even COVID, we're not certain that it is over, really and truly over. We hope so, but we don't know that for sure. So it's really critical for higher education institutions to think, what can we do to maintain access to mental health services? What can we do to maintain access to quiet learning spaces, right? What can we do to maintain access to, say, food services, right? So those things are really important. Several universities have done a good job allowing youth in care to stay on campus, but usually young parents actually cannot take advantage of that, right? So if you're a young parent, you're not able to bring your child to live with you on campus. So this is a really vulnerable population that really had no, there was no planning and no services available to them in most situations. So that's one implication that I think all of us collectively should think about. The other thing, which I think was discussed extensively since then in numerous kind of forums that relate to students, we need to support students, especially high-risk students, with the transition to online learning, right? We shouldn't assume that they're going to be able to do this without support. We should make staff available to them to help them navigate not just the technology aspect, which I think was done more or less well, depending on the institution, but also in terms of kind of, well, how do I connect with my professor in an online setting? What can I do to connect with my peers, right? So things like that that are intangible, these young people need support with that as well. And then we think that campus-based support programs have a big role to play in those kinds of resources, right? So it's really important for them to make case management services available, for example. So the young people talked about not having any adults to help them navigate application to funding and resources and things like that. That could be a role that the campus-based support programs could take, but also other college or higher education institutions structures, there could be developed to help support that, even if it's in an online format. And then obviously mental health support, again, there's been much discussion about this since then. It's really critical, it's important, and services should remain available through the university during emergency times, because for many of the students, there is no other way that they could access those services, right? So making it not only available, but really also easily accessible is critical, because these young parents talked a lot about how things may have been available, but they're so difficult to access that they just didn't have the energy to do it. They just couldn't master sort of the willpower and energy to go through the motions of getting it. So for this population, it's really important to make services easily available. Automatic eligibility, as much as possible, would be the most helpful for this youth, because we don't want them to have to navigate another system and another application and another form. Yeah, I think that's about it. We would be happy to answer any questions about the study, about conclusions, recommendations, anything that folks might want to ask.
Thank you, Liz and Svetlana, for that wonderful presentation. So if you have questions, if you could please go ahead and type those in the chat, and we will go through them as they come in. So one question that I've received is, what COVID-related challenges that you found do you think are the new normal, or that will continue to be a problem now that things are going back to normal?
That's a really good question. I think that issues related to transition to online learning are going to continue to be a challenge. We see, at least in my university, I'm assuming in other institutions as well, there is a big push to more online offerings. And sometimes the students that struggle the most are the students that need the online flexibility, but also the students that are least likely to succeed in online formats, right? So these young parents would likely be the students who would say, I want an online class because I need to work and I need to support my child. But these young parents would also be the kind of student that then doesn't log in and is not able to kind of navigate online independent learning. So we have to really find a way to make education flexible and accessible, but also to support them in ways that are actually conducive to their success, right? Because the last thing you want to see happen is the students enrolling in college, taking a bunch of online classes, taking on debt, and then not able to graduate because they just couldn't navigate these classes. Liz, I don't know if there are others you think about.
I absolutely agree. And I think one of the things that we've seen with many of our students and really heard specifically with these students was the loss of the emotional connection with their professors and the sense of responsiveness. And part of that, I understand on our end, was also navigating a pandemic, but that really doesn't feel good for any student, and especially for young folks who've experienced such a significant trauma as youth in or formerly in foster care. The relationship and the FaceTime and the connection is so important to adults, including to their professors. So I would just add that too. I think as we're thinking through if youth in foster care, formerly in foster care, who are young parents, want to engage in online learning, how to make sure that they have that emotional connection with their professors, that their professors are ready and willing and capable of taking that on, and making sure too that they, when those conversations happen, that's an opportunity to make sure they're connected to other services and to kind of have a conversation about, what else they might need to support them academically.
Thank you. So the next question is, this is in regard to financial hardships. Has there been any follow-up on how COVID relief spending specific for youth in foster care might have helped alleviate any of the stressors that came up in your study?
So we have not followed up on that specifically, but what I could tell you is that a lot of youth in our study reported challenges accessing those pandemic relief funds, right? So they, and the challenges, there's actually, we have one of our publications is already out in child abuse and neglect talking about this issue. So there would be more information there. And I know, Liz, you have a slide at the end that refers to that. But youth talked about the fact that, if they were filed on other people's taxes because they were in care, then once they aged out, they weren't able to get the stimulus checks or any of those pandemic relief funds. Some young people talked about how their application was denied, and it wasn't denied because they could never get it, right? They needed something to be fixed or some documentation to be provided, and they weren't able to do that, right? They just didn't have the mental energy to try to figure out, how do I fix this to get this money? So I think that while we don't know how this funding affected young people, the ones who were able to get that, what we do know from this study is that it's not enough to make that funding available. We need to make it accessible to young people who might not have supportive adults who would guide them through the process. And if there is a challenge, they don't know how to resolve it, right? And they don't have the energy to worry about resolving it or to seek help and trying to get to the resolution, right? They need people who would be able to sit with them, who would be able to walk them through that and tell them what to do. What kind of documentation do I need? If this happened, where do I go to get something that they're asking from me?
Thank you. So the next question is, how has the pandemic brought to light issues that might have existed prior to the pandemic, such as navigation of large systems for youth in care or youth with foster care experience or parenting?
Liz, you want to take that on, or should I?
Go ahead. Yeah, go for it.
So it's a good question. I think that it really sort of highlights the challenges of aging out in general, right? And how the process of supporting youth through the transition to adulthood is still, it still has a lot to be desired, right? It's not a smooth process. For example, you know, we talked a lot in our study and the recommendations that kind of came out of that about what can the child welfare system do to make things easier, right? During emergency situations for these young people. States did issue a moratorium. A lot of states did that. They issued moratoriums on aging out, which was helpful. Moratorium on eviction, you talked about that. That was really helpful. But some of that response was inconsistent, right? So different states did different things, and lack of clear federal guidance on some of these issues is really was felt, right? So I think if anything that we really have to pay attention to, it would be, we need to make sure that our systems that are supporting young people like those, right, that they are prepared for emergencies and that there's clear federal guidance for states what to do if these emergencies come up, right? So again, I think that all the sort of the challenges that happen during the aging out process, the inconsistencies across states, right, in ages of aging out, some states extend foster care until age 21, others do not. So all of these kind of inconsistent procedures, they become more pronounced during a stressful situation. And it really shows kind of what are some of the things that we need to pay attention to. Liza, maybe you want to add to that. I don't know if I covered this well.
I totally agree with everything you said. And I think that something that our young folks really talked about that I think is an ongoing issue is access to affordable, high quality childcare. That's something that I think young parents in foster care, we really need to help them make sure that they have access. So I'd love to see us getting really organized with use of early Head Start and Head Start, for example, and other childcare vouchers, just making sure that youth do have access to those resources should they choose to have their kids in childcare. And that'll really enhance their educational opportunities. I think that's been an ongoing issue, and the mental health piece, of course, too. So one thing we didn't present on today, but just to mention, is that telehealth has been wonderful in many ways, but the young folks in our study had kind of mixed reactions about use of telehealth. Some really liked that you know, they had that flexibility, but others again really miss that emotional connection of sitting with their therapist. They said, you know, it's really hard to talk about these difficult mental health issues, their trauma, and how it's affecting their current life over the phone or over Zoom. Like, it just felt like there was a disconnect there. And so I think just thinking through how to make sure that youth have access to the kinds of, and also I would say, just to add to that, only some like talk therapy you can do, right, over Zoom, over telehealth, but other things that might be more creative, experiential, using, you know, movement, and being just like some of the locations even that therapy could be conducted in, that help youth to feel more comfortable and not to have it be so like intense face to face. Those kinds of modalities were really impacted by the pandemic. Like, it's just much harder to make those things happen.
And I would also add that it also illuminates some of the structural challenges in universities in terms of supporting young parents, right? Just in general, parenting students, which are now not a minority population. It's a substantial population of students who parent. We have not just youth who are in foster care, but also a lot of our first generation students are parents, and other undergraduate students are parents, right? So we now have increasing population of students that parent, and we don't really have a lot of supports that are built in for this population. Most undergraduate universities and institutions are they're built for the traditional student population, but the traditional student population, right, as it was defined, young, unmarried, no children, that's no longer the majority necessarily in many of our institutions. So I think that we have to really think about what do we do at universities to make sure that we support parents, and how we do that effectively.
Okay, so it looks like we just have one more question. So this will be our last question. So the last question is, has there been any investigation into using peer support or mentoring programs for youth with foster care experience who are parenting?
Not that I'm aware of. I know there's some kind of larger peer support programs for youth in care. I am not sure if there is anything specific for young parents, but I think that really goes to that sort of prior point we were making about not having enough services available and resources available on campus. I think it would be wonderful if there was some kind of peer component where student parents could support other student parents, right? Where they could have a community and navigate some of those challenges together. I'm not, I might be wrong. I'm not familiar off the top of my head with a program that does that, but I think it's a wonderful idea.
Yeah, and here in the DC area, there's a really great program called Generation Hope that is for young parents who are, or parenting students rather. So it's not specific to youth in foster care, but they do have a lot of young folks who've experienced foster care or experienced child abuse and neglect, but never entered the system. And they do a really nice job of matching people with a mentor, and then also doing a lot of like peer support types of things. So that's something in the community here that is not specific to young parents who've aged out of care, but is for young parents generally. And so I agree, Svetlana, I am not familiar with something that's specific to young parents in care.
And interestingly enough, I just read a report that talks about that even for young parent population in general, it's community colleges that have oftentimes more support and structure available to help those parents, but the four-year universities actually do not. As we've said before, they're more geared to the kind of the traditional student population, and they don't necessarily have all of the supports that some of the community colleges do have and do provide.
Okay, well, I think we've come to the end. Oh, sorry, you did have another slide. Sorry, go right ahead.
Yeah, so just to kind of learn more about this project, if you're interested, we have a couple of publications that are already available. One summarizing the focus group interviews and what the students, or I'm sorry, the young parents have talked about in terms of impact of the pandemic. We have our photovoice book available. It's called Storms and Blossoms. And then we have a couple of reports and a webinar that we've done on this project previously. That's not specific to education, but just kind of larger. And then we have our Reshaping Network website, which both Liz and myself belong to. And this is a collection of researchers that do research on sexual and reproductive health and parenthood among young people who are system involved. So please email us if you would like to get any of the publications or the reports. Take a look at our photovoice book, which has some amazing photographs that our young people submitted. So we'll be happy to provide any other resources or answer any other questions.
Great. Thank you so much, Liz and Svetlana, for joining us today. Thank you, everyone, for being here. I put the links to both the NRC FHE webinar archive in the chat, as well as our YouTube page. So this webinar, as well as all others, will be available at those links. Oh, and thank you, Liz, for sharing some of the for links to the articles. Thank you for doing that. So again, thanks to everyone for being here, and please join us for our future webinars. Thanks, everyone.
Thank you. Bye.